everyone, my name's Lizzie and you'll know me from Hive Knits over on Instagram. My Instagram handle is @HiveKnits and my craft is knitting. So just so you know, in this video I'm going to talk about anxiety, low mood, COVID-19 pandemic and burnout. So I think 2020 was my first real experience of having a mental health condition, or knowing that I had a mental health condition. I suppose with hindsight, when I look back, potentially it's something that I've been predisposed to all my life, or have had elements of at other times in life, but definitely October, November last year was when I first noticed that something was wrong. I think what I experienced last year was definitely an element of burnout and a high level of anxiety, and with that came low mood as well. I think, as for a lot of us, the COVID-19 pandemic really unmasked anxiety and burnout in me. I work as a doctor, and working as a doctor during the pandemic has been really difficult for a lot of reasons. I'm not saying that working as a healthcare professional during COVID has been any more difficult than the pandemic has been for anyone else, but there's definitely been challenges in working in this sector during the current time. So before everything kicked off, I was due to have a bit of a break from my medical training and work in A&E, picking up shifts as and when I wanted to for 6 months, and then I was going to go away and travel for 6 months around South America. And the date we were meant to be going away travelling was the 1st of April 2020, which coincided beautifully with when the world sort of exploded. So I worked really hard before that, and then because we didn't go away, I just kind of continued working really hard. And I think that, in combination with the stress of everything that was going on, definitely led to an element of burnout. I started my GP training in August 2020 without having had a real break, the break that I thought I was going to get. I started my GP training, and I was working in psychiatry at the time. And I just, in hindsight now, I can see that over the months that subsequently passed, I was just becoming more burnt out, withdrawing socially. I was making excuses not to see friends, even though we couldn't see people that much over the summer of 2020. Restrictions did lift a bit, but I was just making excuses not to see people. When I spoke to friends, I always just said everything was fine. So there was definitely an element of denial going on. I just found myself getting more and more anxious about all different things, but particularly about COVID-19. I was working in older adult community psychiatry, which meant doing a lot of home visits. I was working in psychiatry and in old age community psychiatry, which meant doing a lot of home visits. And I built up this anxiety and this belief, which now I can see is not rational, but at the time it was all consuming, that I was going to be the one to bring COVID into their homes, and they'd been protected and shielding for months, and that definitely built up and got out of control. Until one day I remember driving to a patient's house and just not really being able to go inside. I had what probably was a panic attack, but I didn't realise it at the time. I suddenly couldn't breathe very well. I felt really, really overwhelmed, really tearful. Everything kind of came to a head that evening. That was one day in October 2020. And I remember thinking to myself, I'm working in psychiatry, but I can't look after other people's mental health if I feel like this. And that was a really horrible thing to think, kind of made me feel like ashamed and like I'd failed in my job as a doctor. And that evening, I just remember my partner came home and found me and instantly knew something wasn't right. And he encouraged me to ask for some help, which I did. I spoke to my supervisor at work, and that led to me taking some time off work and going to stay with my parents I ended up staying for about 6 weeks, just to be away from the triggers for everything, and just take some time out and heal and talk and sleep, and yeah, it was definitely needed. I think even prior to everything kind of happening last year, knitting's always helped me when I feel stressed. Like I definitely do it to relax, be that getting yourself lost in an intricate pattern or just doing a bit of mindless knitting around and around. I've known that it's helped me to relax for quite a long time, and I use it day to day. For example, I'm working night shifts this weekend, and I always feel a bit like down and glum and a bit anxious before a set of on-calls, because I find myself thinking, oh, what will happen, and what will I do if this happens, and what will I do if that happens. And especially with night shifts, that's not a good way to start a block of work, because it impacts on your sleep. So, you know, today, for example, I set aside some time to do some knitting, and I'll probably do some knitting before I go to bed tonight. And it definitely helps me to relax and to just stop the unhelpful thought cycle going on inside my head. Again, looking back to last year, I think I can tell now that I really wasn't very well, because like I said, I normally use knitting like that as a coping strategy, and I just stopped doing any knitting at all. I stopped doing the thing that I enjoy, and actually that's one of the diagnostic criteria for low mood and depression, not finding joy from the things that normally bring you joy. So I think that in retrospect, that was a big red flag that something was wrong. I talked a bit about this in my podcast, my first episode of my podcast, but when I was down, sort of having some time away from work and trying to heal a bit at my parents', it was fantastic, but I did feel a bit like I'd lost my role and my sense of purpose, because what I do is do doctoring and go to work, and they were still going to work, so I was spending bits of time on my own in the day, and I kind of felt a bit like, yeah, I'd lost my purpose, and that was starting at times not to help. So because I had time, which I never normally have, I thought to myself, why don't I try designing a pattern for the first time? It's something I've always wanted to do. I never have the time to do it. Now I've got time, let's give it a try. And I think that really helped, honestly, like, not to be cliched, but kind of give me a bit of a kickstart, and it gave me a purpose and something to like look forward to doing a bit more of the next day and the next day, and watching something like get created by me when I was feeling a bit rubbish, to be able to tangibly see something growing was really helpful, and definitely gave me a bit of a kickstart. And when I think about that time, I definitely think about that as kind of when I started to turn a corner. It wasn't just the knitting, I know that, it was also the talking and the rest and the time away from the triggers, but it definitely was a factor for sure. I think if I have any words of advice, well, first thing to say is, like, I'm not saying that knitting has cured all the problems that I had. I'm a lot better than I was, but it hasn't gone away, and obviously the triggers for what happened are still present, but I'm so much better than I was, and I do feel very strongly that crafting has had a role in that and continues to do so. I would just say, as words of advice, that if you're feeling anything like I did, if what I've said has resonated with you, if you feel anxious, if you feel low, any of the things that have been talked about in any of these stories, then the number one thing to know is that you are just not alone. And don't be ashamed, because I now can admit that I felt ashamed. Like I said, I felt like I'd failed as a doctor. I felt like this isn't me. Like things like this, illnesses can happen to anybody. You wouldn't be ashamed if you fell and broke your ankle. So why is it any different if you fall ill with a mental illness? You've done nothing wrong. It happens to so many people. And I think what's so great about this mini series is raising awareness, and just, you know, even just if we realise within the crafting community how common problems like this are, then I think that can just do so much to help people feel like it's okay to talk about it and feel like it's okay to speak out. And I guess the other words of advice I'd have are sort of from the flip side of things. If someone you know, someone you love is not themselves and you think they're struggling, then please don't shy away from talking to them about it. For me, I was kind of carrying on, definitely in denial, not telling anyone about how I felt, because if I didn't do that, then maybe it would be fine. And it definitely took my partner coming home and finding me in a bit of a mess and prompting me to talk about it, because there wasn't any other choice. And it was him saying, I think it's time to get some help, that really made me take that step. And it was taking that step that was the first step to getting better and getting out of the way I felt. So I know it can feel uncomfortable sometimes, but genuinely speaking from experience, I needed a push. I can see that now. And, you know, I'll be forever grateful. So if there's someone in your life who you're worried about, or you feel is struggling, I honestly don't think you'll make it worse by encouraging them to talk about it. It will probably help just to talk about it in the first instance, but if you can encourage them to seek some help and share their burden, then that's definitely for the best. Thank you. Bye.